When it comes to finding breast cancer, you may already know. The earlier, the smaller, the better. But what you may not know is why a mammogram is a better screening tool than a breast ultrasound.
All evidence-based medicine shows that mammograms are the most effective tool for the screening of breast cancer, and that's why we recommend it to all of our patients starting at the age of 40.
Let's face it, an ultrasound seems a lot more convenient, but here's why the pressure of a mammogram is worth it.
So the mammogram is considered the gold standard for screening for breast cancer because of findings that we can only identify on mammogram.
It helps to think of a mammogram like your favorite dish at your favorite restaurant that tastes just how you want it to every single time you go. And then think of an ultrasound like a dish you like and can find almost anywhere, but tastes a little different depending on the restaurant's chef or the ingredients they use.
Mammograms are a very standardized process. There are certain criteria that each mammographic image has to fall within for it to be considered adequate for interpretation, versus ultrasound is more dependent on the technician who's performing the imaging. So there's standardization of the mammograms versus less so with ultrasound.
Plus, 3D technology is now being used to make mammograms even more effective.
The way I like to explain to my patients the difference between a 2D and a 3D mammogram is that a 2D mammogram is like taking a 2D photograph of a loaf of bread and then trying to identify any abnormalities that might be inside of that loaf of bread. A 3D mammogram is essentially taking that loaf of bread and slicing it, and then allowing us to look at each individual slice to identify any abnormalities within that loaf.
But ultrasounds do provide powerful information, and they play an important role in diagnosis.
A breast ultrasound is actually very helpful as a diagnostic tool in supplement to the mammogram. If we see an abnormality on the mammogram, we use the ultrasound to further evaluate that finding, as well as to identify appropriate targets for subsequent biopsy and to identify possible appropriate treatment strategies.
So it's as simple as that? When it comes to screening for breast cancer, mammogram wins?
Really, it's simple. The gold standard for the screening of breast cancer is an annual mammogram starting at the age of 40.